This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
And welcome live to Dr. Tom Roselle Live. We are here in studio, and as you can guess, this is not Dr. Tom Roselle. This is Dr. Stephanie Pina. I'm sitting in while he enjoys this beautiful weather we have on this Sunday. He's at the beach. I think he's going to be back next week, but needless to say, we are live here and ready to take your questions and talk about some topics about health and what you can do. As Dr. Roselle says, you tried and applied and just haven't gotten the answers or the results that you want. So basically, we're here for you. If you want to call in any time, you can give us a call at 1-888-630-9625. And my guest in the studio today is Dr. Harlan Browning, and he's going to be talking this Wednesday at the Roselle Center for Healing in Fairfax, Virginia, on low back pain. And that is going to be at 7:30 p.m., and that's Wednesday the 23rd. And welcome, Dr. Browning.
It's always good to be here, Stephanie. I think this is our second time in as many times that I've been in the studio that we've done it together.
I think we've done almost every single time.
Yes, we have.
So at least our topics keep changing, so that's a good thing. It's not always the same thing. But low back pain obviously is something that many people have been suffering from. They're worried about. It's estimated between $50 to $90 billion a year are spent on treating low back pain. It's the number one condition that keeps people from work. It delays work in progress. And at any time, a fourth of the people out there, especially in the U.S., can be suffering from low back pain. So, Dr. Browning, why is it that we see so many low back pain issues, and why does that come up so often?
Well, as you said, outside of the common cold, the second most common reason that a person goes to see their healthcare professional is for low back pain. So it's certainly very prevalent. I think the reason that we see more and more people developing low back pain is because we're transitioning more to an industrial society. So we sit more, we move less, and that's a combination for disaster. As we sit more, our tissues have a tendency to get shorter. And as they get shorter, it's going to affect the way our spine moves. And as we alter the normal mechanics of the spine, it's going to break down faster. And the byproduct of it breaking down is inflammation and then ultimately pain. So what we're going to talk about on Wednesday really is going to focus more on the chronic pain syndromes as far as the low back is concerned. And we're going to look at sequentially at why these things happen and very often why the therapies that we see utilized in Western medicine are not getting the job done.
Now, we see a lot of people that come in and, when you read about low back pain or you talk to friends and family who have had issues with it, we're talking everything, like you were saying, discussing the chronic aspect of it, but acutely, most people, might pull something really quickly or they're, having a great weekend like this and they're out playing a little too hard or trying to get work done. And, when does someone know when it's become more of a chronic issue and they need to be seen?
Well, the body has an amazing ability to heal itself. So for most of the time, when we injure ourselves, our back, our shoulder, our knee, within 2 or 3 days, the body, if it has the capacity, will get the situation under control. The pain will disappear and the tissues will heal. And that's probably the most important part of the whole process is the tissues actually heal and restore themselves pretty close to the way they were before. What typically happens in a chronic pain syndrome is the irritative factor is never completely removed, so the tissues continue to break down. And when we say that could be the disc, that's that soft, spongy part in between the vertebrae. It could be the ligaments that are surrounding the vertebrae, and it certainly could be, the musculature that's there as well. The issue is that there's lots of nerves that go to all three of these tissues, so we get this constant bombardment of pain that's going into our brains. So unless the pattern is broken, it's going to continue, and very often it escalates and leads to other things.
And we can see even some of that with acute issues when they haven't been corrected over time properly, or some other disease as well that just brings up inflammation in the body, and it kind of finds that weak spot if it's in their low back as well, correct?
That's correct. And it's important to note that inflammation is a good thing on the short term, and actually research is bearing out that maybe we shouldn't be putting ice on injuries as quickly as we have. Now, that sounds like a strange thing, but what we're finding is when we ice things inappropriately, maybe too soon, the body will actually suppress its own ability to go in there and clean up the tissue. So inflammation on the short term is a good thing. Inflammation on the long term is a very, very bad thing. And for most folks that have chronic pain syndromes in the low back or anywhere else in the body, that's certainly what's going on.
Well, you bring up a good issue with the ice price type of thing that we've always been taught, and as far as acute injury and stuff too. Unless people really know, what is the benefit when it comes to, what was the original idea of putting ice on there as far as, say, comparison to heat?
Well, ice quickly will help to reduce the pain level, because ice cools down those nerves and slows their ability to conduct the pain sensation to the central nervous system, so it will feel better. It also will definitely help with the swelling component. So if we have less pain, less swelling, then it would seem that we're on the right track, and for the most part that's true. But we might want to think a little bit more about how we treat the acute injury as far as taking the anti-inflammatories and utilizing the therapies that we currently are utilizing. So there's other things out there, and now we're seeing the research say maybe we should take a step back and look at what we've done over the past and see if it is actually getting the job done.
Well, I know in Chinese medicine, they, ice is very constricting, and then, heat is vasodilating, so you get more blood flow in there. So they don't use a lot of ice therapy, but in certain times they will. Or we use more alternating hot and cold to kind of create a pumping mechanism in there. So it definitely gets more blood flow to the area, but you don't want that swelling and stuff in there too. So, all right, low back pain is our issue for the day. And if you have any questions about low back pain or anything else, feel free to give us a call here in the studio. If you're interested in this topic in general and like to hear Dr. Harlan Browning speak, please give the office a call at 703-698-7117 to sign up for the lecture. There are limited seating, and this is probably going to be a full one because there's a lot of people with low back pain out there. I know everybody every now and then has a little creak in the back, but then all of a sudden, if stuff doesn't seem to be getting better, they kind of have to come in at the last minute, and they're kind of saying, now I want to avoid surgery, I want to avoid having to take these medications, and it's not really doing anything for me. So this is a perfect opportunity to understand what's going on better in the low back, from the structure all the way up. And I think this is going to be an excellent opportunity, so feel free to call the office and reserve your seat. Now, when we look at all of the possible types of low back pain and issues that might be coming from there, everything from, disc degeneration and sciatic pain going from the hips down to the leg, even when we're looking at bulging discs and spinal nerve degeneration, is there anything about the actual low back pain, that those lumbar and the sacral vertebrae that are so different from, say, the thoracic and cervical vertebrae that makes them more vulnerable, or certain areas of the body more vulnerable?
Well, first and foremost, because they're holding the whole weight of the body, they're at a distinct disadvantage. So from that standpoint, they're more likely to break down, specifically the L4 and the L5 disc. When I stated before that I think that because we're moving to such an industrialized society where we sit all the time, that is the beginning place for most people who have their problems. What happens is when we sit, certain tissues become shorter. And in fact, the hip flexors, that's the muscle that lifts the leg into the front of the body, become tighter. At the same time, your hamstrings, that's the muscle behind the leg, also becomes tighter. Well, for that process to take place, certain muscles that do opposing actions actually get weaker. So that's the abdominal muscle groups and the glutes. The glutes are the big butt muscles. So as we get one half of this cross getting too tight and one half getting too weak, then the spine becomes pulled out of its normal position. We start to lose the curve. And as we lose that curve, then the discs and all those sensitive tissues start to break down. And it's usually a slow process. And in the beginning, typically, we might just have some stiffness, but as time goes by and that tissue becomes unstable, it will start to hurt.
So even thinking outside of the spinous process, which is kind of like our center point, and the muscles that basically surround it with the tendons and ligaments kind of trying to hold us up and allow us to function, if there's an improper balance between one side of the body, say, contracting and firing because it's overused or there's some kind of strain there, we can start to develop things like low back pain because it's going to start having an effect on the spine itself, right?
Exactly. In neurology, it's called the law of reciprocal inhibition, means that when one muscle group contracts, its opposing group, the one that does the opposite action, has to relax. So we can push the neurology in one direction versus the other. When we have muscles that are very tight, then we're going to shut down the muscles that are in opposition. And it's actually called lower crossed syndrome. This is a term that was coined by some doctors from the early 40s and the 50s, and it just didn't get enough PR, and now we're kind of coming full circle, and folks are starting to talk about it. So it's a real phenomenon, and it becomes really important with chronic pain syndromes.
All right. Well, we have a caller in. We're going to talk to Matthew. Matthew, how are you doing today?
Oh, I'm well. How are you?
Doing great. You have a question about low back issues?
Yes, ma'am. I'm 26 years old. I was back in April 2 years ago. I had a laminectomy discectomy of my L4, L5, L5, S1. Everything after the surgery, the pain was better, but then the further we got away from the surgery and into more physical therapy, I started to notice the pain was coming back in the leg and then down from one leg back to both legs, and then eventually all the way back into the back. And they sent me in for another MRI and showed that I had scar tissue building around the nerve. And when I asked them what the options were from there, they said, they can't go in and operate because scar tissue, you can't really remove it, and if we do, it's just going to come back. So the only option they really gave me was to do pain management or to do a neurostimulator. Is there another route that I can go? What are my options?
Hey, Matt, this is Dr. Browning. So your outcome is not that uncommon post-surgical. Usually when a low back surgery is going to fail, and they fail about 50% of the time, which means the person is not gotten better and has not gotten worse. What happens is as the scar tissue forms, it takes up room. And typically the reason we form scar tissue is because when the surgery is done, muscles are cut, unfortunately. And as they grow back, they will form scarring in what's referred to as the adhesion. And the adhesion basically is grabbing hold to the nerves. So there's certain things that I like to utilize when we have scar tissue that helps to physically break it up, and that's unfortunately what needs to happen. That scar tissue needs to be separated so it doesn't continue to form. It's almost like a spider web. There's a technique that I utilize called Flexion Distraction, which helps to isolate the disc level, so in your case at L4 or L5. And I also like to utilize something called a cold laser. It helps with localized inflammation. Now, Dr. Pina, I know this because I'll send my patients to her too, can do specific acupuncture needling techniques to those levels that are very effective as well. Would you like to comment on that, Dr. Pina?
Sure, yeah, absolutely. Well, the main things, too, is you can work locally on those same areas where there's the scar tissue, and even the areas where they basically had done the surgery to help promote some more blood flow in there. So if it's just a healing response, or what's interesting is when I work together with Dr. Browning and I'm using acupuncture, I know that he's working on a specific response. So what I want to do with the acupuncture is basically help the body kind of decrease the inflammation and respond better to them. So there's a number of integrated techniques that you can use to really help out in the situations, especially where surgery, like they kind of said, they can't go back and fix it. So once they've done it, basically it's never going to be 100% perfect. So we're kind of going for where it stands now and going from there.
Okay, and a lot of the pain I feel is tightness, is laying in bed. I don't sleep very well due to just after a few hours, everything just gets so tight back there that nothing's comfortable. And being that I was 24 when I had the surgery, they said I wasn't eligible for most people that had a fusion. But since I was only 24 when this happened, that they would not do the fusion because I wasn't old enough and I was still growing. Now they're kind of taking that back since it's 2 years down the road and saying, well, we might need to go in and do a fusion. And I've talked to many people, and many people, they've had the back surgery problems, but they're not in the age group. So they automatically had the fusion done when they had the laminectomy discectomy. So I don't know whether to go, for the fusion route again and see if that helps, or to try to get some of the scar tissue broken up and just let, kind of natural healing and being able to just get some more flexibility, some more range of motion.
Matt, the one inherent problem with the fusion, and you'll find very few competent neurosurgeons that would disagree with this comment, is it's going to foster degeneration above and below the levels that they fuse. So typically surgeons prefer not to do fusions unless the area is unstable. In other words, there's so much degenerative change in there that the vertebrae are literally moving. So if they fuse L4 or L5 and maybe a 2 or 3 level fusion, then the likelihood that the vertebrae above it, L1 and L2, degenerate is pretty high. And you're how old are you now?
I'm 26.
Yeah, so at 26, you're probably going to be looking at some other issues, another 5 to 10 years down the road. Wednesday, I'm going to be talking a lot about specifically post-surgical failure type stuff, meaning that folks that had surgery and the outcome just wasn't that great. So I can certainly add a little bit more insight into that, and we're definitely going to go into more of the rehabilitative side, the things that we do in the office to help address those things. So I would recommend come on out and we'll talk, and if we need to sit afterwards, and if you have any specific questions, we'd be more than happy to handle that as well.
All right. Well, I appreciate it. Thank you, guys.
You're welcome.
So it was a great question for Matthew, right on topic. And, yeah, especially at that age, there's probably a lot more we can do than some of the patients that come in and they've had chronic issues on top of that, surgery plus then. So we're going to keep talking about that in just a couple of minutes. We're going to take a quick break, and we'll be back to talk about low back pain. It's myself, Dr. Stephanie Pina, and Dr. Harlan Browning.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
And welcome back to the Dr. Tom Roselle Live Show. This is Dr. Stephanie Pina and Dr. Harlan Browning. We're sitting in. We have the mics today, and we are answering your questions. And it's interesting that Matthew brought up so much information about surgery and healing, especially at such a young age. Now, when we look at surgery and, in the office, we try to prevent people having to go to surgery. But sometimes we do see them come in and, they're post-surgical, and there's a lot of stuff that can be done to prevent that. And also once they come in, Dr. Browning, what do you think about, and we've actually sat down with some neurosurgeons that that you've referred to when you need to do that. And they're excellent people in trying to explain to everyone how that works. But what do you think is one of the major drawbacks and pros and cons of when people are coming or having to think about surgery?
Well, I think the biggest thing is when there's an over-indication, when the person does not necessarily need the surgery. And what I mean by that is when we have low back pain, we also need to figure out if the person has started to develop an impairment. An impairment, I mean, are they developing weakness in a leg? Are they developing a loss of a function? Because when we have a pain syndrome without impairment, we certainly have a lot of opportunity to turn that issue around. And very often folks will have perfectly good function and just have a lot of pain, and then they will get talked into having a procedure that really wasn't necessary. And I certainly encourage, most folks to try every and all conservative options before you go down that route of surgery, because once that surgery's done, you can't go back.
Yeah, we definitely see that, and people come in for a number of different reasons, whether or not they know that they have a back pain issue that's related to disc or to the bones and joints, or, even if they're feeling it kind of radiating down into their legs, like with sciatic pain. So there's definitely a lot of different things to kind of take into consideration on where that pain's coming from, and it's not as simple as saying it's at one simple level. So
right, and you hit on a very good point. There's lots of pain generators in the back, and in a real world, it would be great if we could just blame everything on a disc bulge, but we now know that upwards of 60% of the general population has a bulging disc and has no aches or pains. So we have to look outside that box of just purely the disc and the degenerative changes, because sometimes we can have advanced breakdown of tissue, and the person's really only complaint is they're a little bit stiff. So we want to really make sure that we understand where the pain's coming from. If not, then we might be pushing the surgical option a little bit too soon.
Well, what we're going to do is we're going to take another break real quick. Sorry, folks. And then we're going to answer some questions. We do have George on the line, so hold on, George. And we're going to keep talking about low back pain and what you can do about it. This is Dr. Tom Roselle live.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to the Dr. Tom Roselle Live Show. This is Dr. Stephanie Pina and Harlan Browning, and our topic for today, and also the in-house educational lectures, which are free to attend on Wednesdays, July 23rd at 7:30 p.m., is low back pain. If you are interested in coming and you definitely hear something that you hear today that is of interest, or you have more questions on the topic of low back pain, you are welcome to attend the class. Just give the office a call at 703-698-7117. That's 703-698-7117 to reserve your spot to hear Dr. Harlan Browning talking about low back pain. And coming up also, as you hear over and over again, you have already missed the pre-registration, but you're in the middle registration for Ageless Health 2014, which is going to be on Saturday, October the 18th, I believe, 18th or 19th? 18th. And it's going to be at the Fairview Marriott, there we go, over in Falls Church. And essentially it is going to be a great day of learning and excitement. Learn some keys to basically help you understand your health better, what you can do moving forward. All the presenters that you hear with Dr. Roselle, including myself and Dr. Browning, actually present on that day. I think we get the morning shift, so that should be fun.
We do have the morning shift.
Yeah, I think we're back to back, so it's going to be 1 and 2. Right after Dr. Roselle does the opening remarks. But if you're interested in coming out, I believe the second pre-registration is still open till September 15th. You can save yourself $20 by calling. You can either register online at agelesshealth2004.com, or you can call the office as well when you're signing up for Dr. Browning's lecture at 703-698-7117. It is going to be $79 till the 15th of September, and it's going to be an amazing day. We all learn a lot, even myself from the other doctors. We get intrigued. We don't know what they're going to talk about, but there's more information online, and hopefully you can attend us there and meet us in person as well, too. A lot of people come to our in-house lectures in the office, but then they also want to come to Ageless Health to really see us all in action, and even Dr. Roselle. People always go, that's what you look like. Gotcha. So we're going to take a quick call from George. How are you doing, George?
Hi, thank you for taking my call. I have an experience to share as well as a question to ask.
Sure.
Probably 12 years ago, I have 2 bulging discs in my lower back. Big gym guy for years, and I was considering surgery on the whole thing. I went to see probably a half dozen back surgeons in the Northern Virginia area that I consider, well, actually they're ranked top surgeons. The last one that I went to see over in Reston, I'm not going to mention his name. You would know him. He's world class. His first name is Tom. Went in, and I really had said to myself before I went in, okay, whatever this guy says to do, surgery or not, I'm going to do it. Because I used to walk and my left leg would go numb, and I almost fell down. I couldn't walk. Went in and talked to him. He looked at me. He says, George, he says, after he looked at the x-ray, he says, lose 15 pounds, which I did, and I kept working out. That was my experience. My question is, over the years, the pain and the numbness has gone away only because I continue to work out. What is your take on steroidal use for lower back pain, provided that you're not 15, 20, 30, 40, 50 pounds overweight?
Well, George, typically they use steroids. That's kind of a first-line conservative defense in office for a lot of the surgical guys. I get what they're doing. They're trying to control inflammation, and certainly if there's any nerve root irritation, the issue becomes if you do not address the reason why the problem there is to begin with, the likelihood that disc is going to continue to degenerate is pretty high. The likelihood that it's going to come back, is fairly high as well. The issue again also becomes that steroids damage healthy tissue as well. So if we're going into a pretty small area, L4 or L5, and we're injecting it multiple times, and they'll usually do a series of injections, then the ligaments might be broken down a little bit more than we'd like to see. So it becomes a stability recidivism issue leading down the road. So that's my real major concern with it.
So you would say don't take that route. Now, the steroidal use I'm talking about isn't directly into the joint. It's more or less general steroid. Your testosterone, basically. If you're an older guy, typically if I build up my core to where it should be, my back pain is minimal. When I don't, it's maximal.
So you're referencing them giving you anabolic steroids.
Well, not to the extent of everybody's rolling their eyes saying, "Oh, he's on steroids." That's not what I'm talking about. Because typically when you get older, you lose the steroid amount in your body. What I'm talking about is the ability to work your midsection at an older age to where you can build up your core to where it helps the surrounding discs around there. Because if you have abs, if you're not carrying a basketball in front of you, certainly it should help the discs.
Yeah, I would totally 100% agree on that one. If you have very poor core integrity, and for what he's talking about for the other listeners, if they don't understand that, is we have a series of muscles that surround our spine and provide stability almost like a girdle. We now know that the core musculature is much more than the six-pack abs. That's called the rectus abdominis. Actually, that's really not part of the core. It's the deep, deep muscles that called the transverse abdominis and something called the multifidi. These are muscles that are right up against the spine. They're the ones that supply a lot of the stability, and they're most effectively trained in very static positions. So the old school sit-ups are not the thing that we want to do. If we really want to strengthen those core muscles, we need to do things in relatively stable positions. So I'm a big fan of the core training.
Okay, well, thanks. I think that answers my question. I hope that I've helped other listeners as well.
Great, thank you,
we appreciate
George.
that call. So he brings up a really good point that you need to concentrate on things that you can do yourself. So what he said is a profound statement that I wish a lot of my patients would say, is like, maybe I should lose weight or maybe I should exercise more. That usually doesn't happen. It's usually me making that suggestion. So for all the other listeners today, that I think George was right on the money that maybe we should take a little bit more responsibility for our own health care, and that would involve stuff that we can do at the gym and the way we eat, meal planning and all that type of thing.
Well, we know, too, just even some of the foods and stuff that we bring in when he brought up weight loss, eating less inflammatory foods that are going to keep causing that reaction going against our system. They're foods that are hard to break down for the stomach that we hold on to that affect our adrenal system, so we can't heal properly, infect our immune system from there. Some of those foods, even when you look at the quality of them and the micronutrients and stuff that are coming out of them, leading to things like osteopenia, osteoporosis, that are kind of setting us up for the ability to have these continuous issues and stuff as well.
Yes.
So he kind of brought up some great things between, typical things you would do for any kind of low back pain, weight loss, movement, getting active, making sure you can kind of get both sets of those muscles moving, even around the area as well too, and then making sure you can get inflammation down and address any other issues that's going on in the body.
I think it's important to, when you want to look at a pain syndrome specifically, let's say we're going to look at a low back issue, we need to kind of open up our thought process on why we have the pain to begin with. Most, medicine is very neurogenically focused, meaning that we're going to look at the nerve. Well, I can tell you from experience, and I can tell you from people getting better, that you need to also look at the chemical mediation of pain. What's going on in the chemical side of the body, and that goes back to what you referenced as far as what a person eats. So if we're eating foods that are very inflammatory in nature, be that refined flours, sugars, processed foods, artificial sweeteners, food additives, food colors, those are very inflammatory. They push our pHs more to an acidic side, and our nervous system is predicated off of a good balance between alkalinity and acidity, and if we start to shift towards that acidity side, then our nerves are going to be more apt to fire, and that means that they're going to tell the nervous system that there's something going on. So just something as simple as changing the diet and putting foods that are very nutrient dense in anti-inflammatory properties, like the omega-3 oils, then people are going to be less apt to experience pain, and the quality of their healing is going to be that much better.
Absolutely. And I know one of the interesting things that you spoke on a couple years ago in Ageless Health had to do with fascia. And I know when we think, like you were just saying, it's not just the nerves that kind of create issues in this area, but it can be the muscles, it can be everything else, those connective tissues. Can you briefly kind of, recap your fascia lecture? Because I think a lot of times people come in and, they're doing everything they can. They've either, God forbid they had to go through surgery, but they're getting adjustments. Everything's opened up. It looks fine. And they're still saying, I'm having this tightness, whether it's more in the muscles or not. But they're seeing stuff that might be related to fascia as well.
So for folks who are familiar with the fascia, think of fascia is like pantyhose. A woman puts pantyhose on, it surrounds her whole leg. Well, fascia does that too. It surrounds the whole muscle, and it has a large role in the ability for muscles to slide against each other. Muscles need to have good fluidity. So when the fascia breaks down because of injury or because of overuse, then it's going to develop what we call adhesions. And these are morphological changes that occur slowly over time. These are the knots that we get in the muscle. And as we form more of these adhesions, then the muscles perform substandardly, and they emit pain. So a lot of what we're seeing with people who have chronic pain syndromes is really more changes in this fascia and the connective tissue than it actually is the nerves. And as a backdrop to when I did that specific talk just on fascia, a lot of the information that I was presenting during that little lecture was from the Fascial Congress. There's a large brain trust of doctors from all over the world, and all they do is study fascia, and they put on this annual conference, and it travels around the world, where the people who are in the know come and talk about the importance of fascia. The fascia is a living structure that is a huge network in our body, so we don't want to discredit the ability for that fascia to move properly and for us to have normal muscle function. So that's a big part of it, and that's where massage can come in, or some of the muscle fascial techniques come in. Using a foam roller for those people who go to the gym and use those. Those are all extremely important pieces.
Well, we're going to try to take a quick call from Al before we go to break. Al, how are you doing?
Okay, thank you very much. I'm having trouble with my feet, and first thing I noticed was a discoloring where my both feet and ankles turned reddish, like you had sunburn. So when I went to the primary care physician, they diagnosed this as a circulation problem and referred me to a vascular surgeon who said it was not a vascular a problem, but when I touch the top of my, especially my left foot, or put a shoe on, it feels like sandpaper rubbing on my foot. So then I went to a podiatrist who took x-rays which showed no structural damage, and I gave a cortisone shot which did nothing. So then all he gave me was painkillers. So then I went to an orthopedic surgeon who said that if the x-rays show nothing and the cortisone didn't help, he couldn't help me. And that's where I stand.
Al, how's your blood sugar?
I have no other problems. I take no medication at all. I'm 75 years old.
And how far up?
Just the top of the foot.
Just to the top, and it's all the way around to the back of the heel and all the way.
No, just the top from around the toes up toward the ankle.
And it's in both feet?
No, just in the left foot.
Okay. Do you have any numbness or tingling as well?
Only if I stretch my foot, like right now, it'll feel like a little numbness if I point my toes towards the ground.
So my first thought when you describe all this is that this may be coming from your low back at L5. The nerve roots that from L5 and the first sacral level go all the way down to your foot. So very often when we're having compression or irritation of those nerves, the first complaint that we have is not low back pain, it's actually foot problems, and that could be anything from a person saying their foot's falling asleep to where they have pain in that foot. And that would make a lot of sense in your case, because if the x-rays of the foot are fine and the vascular part is good and you don't have a blood sugar handling problem, this sounds to be a little bit more neurological. Most likely I would think it could be upstream a little bit in the low back. Certainly there's also acupuncture channels that go through there. So Dr. Stephanie, I know that you, in what you do, would probably look at the pattern of the meridians that pass through the foot as well.
Yeah, absolutely. There's areas that you can affect circulation without there being a circulation issue, but then also work on that neurological issue as well, too. So if it's coming from the back, it's really important to get this addressed and get it looked at by someone who knows what they're doing, because it's not always something that surgery is going to fix. And I think having all those surgeons tell you that there's no way that they can help you is because they're kind of running out of answers. Yeah. So they're looking in the wrong area. Your body's just showing those issues, in the feet itself.
Yeah, Al, I would just, talk to your doctor again about that and see if he can expand his diagnostics to include the low back. And if he's not willing to do that, certainly give me a call at the office. I'll do as much as I can to help you as well.
Would the discoloring, though, also be involved there?
Yes, it certainly could, because you get what's called trophic changes. When a nerve is compressed, it also communicates to what's referred to as the autonomic nervous system. This is the rest and digest, or this is the fight or flight, and that has a lot to do with how our blood vessels open and close. So if we irritate the tissues, the neurological tissues, one of the first things that you might see above and beyond pain is the changes in the skin. In many cases, the skin will almost look shiny, and the hair will be lost first before we even develop any type of pain. So, yeah, definitely the nerves can affect the color of the skin as well.
So it would be a nerve problem that acupuncture could help?
Yeah, certainly. And again, I think we need to look closely at the low back as well, because if we're getting compression there, which you very well may be, if you don't decompress that nerve, you'll just get temporary relief, and ideally we want you to get back to normal.
Well, thank you, Al, for calling, and we're going to take one more quick break, and then we're going to come back and finish up the Dr. Tom Roselle Live Show.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
All right, we're back, and I want to send it over to Dr. Browning to wrap up quickly what you can listen to on Wednesday the 27th if you're coming to the Roselle Center for Healing to learn about low back pain. So, Dr. Browning, what's going to be the big issues you're covering?
Well, I think I'm going to spend the majority of my time talking about chronic back issues because most of the folks that show up to these lectures are dealing with things that they've been having on and off for a long period of time. So we'll look real closely at the things in the back that cause us to have pain. We're going to expand on the typical things, like I said before. We're going to really talk a little bit more about the fascia, the importance of the ligaments. I'm going to talk about diagnostic procedures that typically are not utilized that I think are essential to figure out where the problem comes from, including ways to do x-rays in different ranges of motion. I love to do those tests. We'll look at conservative measures to fix these problems. These are going to be things that I utilize, things that you utilize, and ultimately coming up with big strategies on what people can do at home to keep it that way. So we're going to have a big question and answer at the end. So hopefully we'll answer everyone's questions and at the same time give them a little bit of information on how that they can fix themselves.
All right, so hopefully everyone gives the office a call, 703-698-7117 to sign up for that lecture. It's going to be busy, so reserve your seat. Next week, Dr. Roselle will be back, so hopefully we'll be able to answer some more questions, and have a good weekend.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.